This event is brought to you by the Yen Marketplace. The Marketplace is our new web portal that we launched this year, and it's an opportunity for youth employment practitioners and young entrepreneurs to find, exchange, and ideas, resources, and partnerships. Different services for young entrepreneurs, such as e-coaches. We'll be launching a business idea competition later this year, and it also has various links to funding opportunities. If you would like to stay up to date with our bulletin, which we send every 2 weeks, we'll put a link in the chat. You can sign up for the Marketplace bulletin. And now, before we get started, I also wanted to go through some very basic things on webinars for those of you who are new to the wonderful world of webinars. Very quickly, this button will allow you to manage the size of the webinar presentation, so it will fill your screen. This button will show you the expanded panel, which is shown on the right. And here, you see that everyone at the moment is muted. If you want to speak, you'll be able to raise your hand during the question and answer session. Raise your hand, Sharon, who's doing the facilitation for the event, will unmute your mic and allow you to speak. Another way you can also participate is the questions and chat box. So if you have a technical question or you're having trouble, you can type in a question here and click send, and someone in our team will get it. Otherwise, you can also type in a question for Ting, and we will try to respond to as many of those questions as possible during our question and answer session. The feature I wanted to show everyone before we start is the poll. So let's go ahead and try to do a poll right away. So could everyone tell us where they are located? Okay, so I hope you can see the results of the poll. 57% of the people attending our webinar are in Europe, 29% are in Asia, and 14% are in Africa. Given the time difference, that's probably why we're not seeing many people from America and Australia. Okay, so let's get started. I wanted to just introduce Ting. 4 years ago, Ting founded Click Diagnostics, a social enterprise born out of the MIT Media Lab. It conducted mobile health pilots in over 10 countries in Africa, South Asia, and the Middle East, as well as North America. She founded ClickMedix to build upon the success and learning from this 3-year process. Created a highly reliable, secure, and user-friendly telehealth platform that can be deployed quickly to health practitioners and connect patients with medical experts worldwide. Ting leads the design, development, and deployment efforts of ClickMedix, affordable mobile health, telemedicine, and education platform. Ting is also the Cartier Women's Initiative Awards Laureate for 2012 for North America. She holds an MBA from the MIT Sloan School of Management and Master of Science in Systems Engineering. Ting will give us a 20-minute presentation on her work, and then you'll all have a chance to ask her questions following the presentation.
Let me adjust it. All right. So ClickMedix, the idea for it started while I was a graduate student at MIT. We were told to create a business that would impact over 1 billion people. When we thought, well, how? Most of the people are, to get that volume of people, it's in India, China, mostly developing countries, and also developed world. It's got to be a way to reach people that with the tool that they already have. So we thought mobile phones. And most of my team are just passionate about healthcare because anything you do in healthcare ultimately result in saving lives. And so we started with a very, very simple concept of let's use the mobile phone as a way to capture information and then sending that information to doctors who are remote, because there simply aren't enough doctors in a lot of different places, and there may be less ability for the patient to afford seeing the doctors. So we started with a very simple idea. And then we took the idea, created a prototype with the mobile phone and some very simple software that we just put together. And we started testing it. And in one test where we went to Botswana, there's such a need for cervical cancer screening because 25% of the population in Botswana have HIV. And because of HIV, it exacerbates all the other related diseases, and one of them is cervical cancer. It typically takes about a year for a pap smear result to come back to the doctors, and the doctor would have to somehow find the patient again and tell them whether they have cervical cancer or not, and then continue with regimen. That is not acceptable and not doable in terms of the wait time and locating the patients later on. So what we did is we used the mobile phone application, and we taught the nurse midwives to use the mobile phone to take images of the cervix after vinegar solution is applied to the cervix. I'll show you what that looks like. So on the left you have the healthy cervix, on the right you have the one with cervical cancer lesions, and it's the white lesion which actually becomes very apparent to the trained eyes as to whether there's cervical cancer or not for this patient. And they were also taught to remove the lesion immediately. So we actually were able to teach 2 out of the 4 nurses to be 100% as accurate as the women's health expert in terms of diagnosing cervical cancer. We thought, wow, for something at a prototype stage, and for us to achieve that type of literally life-saving results, we were psyched, we were pumped, let's do more. So we did use the same concept, and we said, well, what can we do with surgery? What can we do with x-ray? What's the limitation of the data we can capture to actually send it to a remote doctor? So we tried various disease interventions, including malaria, tuberculosis, including primary care, and we published our results, and then we also did cost savings, because ultimately your business needs to be sold to someone who cares. Most people care about money. Either they're saving money or they're making more money. So in this cost savings study, we looked at all the transportation costs that the government of Botswana is actually paying, and looked at what is the savings just simply by using mobile phones for diagnosis and remote care. And it turned out to be about more than $250,000 in US dollars every year off of transportation alone, not counting any hospital savings. So this is quite an enormous number with a very simple concept and intervention. And in the work of healthcare, and really in any other industry, you have to show proof of concept. You have to show that there's authority behind what you're doing, especially when you're trying to do something that's seemingly novel. So we published all the research projects we did, resulted in more than 10 publications. And in healthcare, it's all about who has the research to show a new concept. So this was an important aspect in our industry. So we did various presentations and really just showcasing you can just use a mobile phone, something that's so simple and accessible and affordable, and use it for remote diagnosis telemedicine. And we also thought, could this be just a developing country intervention? What can we do in the U.S.? Turned out, situation in the U.S. is way worse, because in the United States, we spend in a year $2.65 trillion. That's 12 zeros after the 2 for healthcare in a single year. And that cost is only rising with the increase in senior population, and also there's chronic multiple diseases. It's probably worse than any other country I've been to, and that's more than 10 countries where we've done the studies, simply because of the cost is just unaffordable. So we did a 900 patient study looking at how many of these cases can we see just remotely with a mobile phone. And it turned out 65% out of 900 could simply get a consultation on whether they have skin cancer or any other type of skin diseases within 3 days. Current wait for them is 6 months. Completely unnecessary and completely not helping the patient. So we thought, okay, this is great. What else can we do worldwide? So we ended up piloting in more than 10 countries over the last 3 years plus in interventions that also included maternal and child health care as well as senior care. And we created a list of value proposition. It's great for the patients, takes less time. It increases revenue for healthcare providers. It helps hospitals serve more patients without increasing their costs. And certainly with the research data and the data we're able to collect, it will actually expedite some drug discoveries as well. So with any business you're building, this value proposition and how you're backing up why your product is better is really key. And that should be an outcome of your concept and prototype pilot stage. Because with this, you can start getting investors and other funders as well as your customers interested as to, well, why should I use your product? Why does it help? Show me, prove it to me. Because they are a lot of skepticism with regards to new concepts. So the rest of this presentation is really centered around how do we tap into this enormous trillion-dollar market and make it more efficient as a small startup. So certainly the way to become a large player from just a concept, just a pilot, just a small team is through disruptive technology. In order to disrupt our marketplace, you really do need to understand how you are solving some of the root causes and how is your solution better than anybody else. So we clearly identify the root causes that are accessibility to doctors, can someone afford a doctor, and that there is certainly just a shortage of doctors. There are not any more people trying to go through 10 years of medical education. There are certainly not a line of increasing number of doctors in the pipeline. And we thought, okay, well, let's look at the current approach in order to engineer a new approach that is really beneficial to the end patients. If we look at healthcare today, whether it's in developed world or first world, you may have a health worker or an aide to help someone who's sick, and on the left, you have a health worker training a pregnant mother, and on the right, you have a nurse aide helping old grandmother, Mary, to better understand her medicine needs. But when the pregnant mother, in this one is in Uganda, gets sick, she literally has to carry her baby all the way through this road that you're seeing on the left. It takes about 3-4 hours. I've been there. This is actually my picture. Walking through just to catch the bus and then take another 4-hour bus ride and then catch another train, maybe if she can afford a train, to get to the doctor. In first world, you of course have traffic, and certainly you may not be able to drive yourself, so you're asking your family member to help you along or anybody else who can drive you. Once you get to the clinic, most likely you're waiting in whichever environment, and a lot of times the doctor may say, I can't help you here, but try this medicine, and you still need to see another doctor at the capital of the country, or you need to get 3 more diagnostic checkups. All of this take time away from the patient who are already sick. And unfortunately, many developing countries, pregnant mothers end up having birth right in their homes where there isn't as much equipment or medication for any urgent situations such as hemorrhage, causing many unnecessary deaths. In the U.S., Mary, she actually ended up fainting in a grocery store and was sent to the ER where she was diagnosed with stage 4 cancer. And this is completely preventable, and I am puzzled as to why isn't there a better solution. And that's why ClickMedix is developed, and it's developed to be a disruptive technology so that we can really look at how we approach healthcare from the patient's perspective, because they do not deserve what we currently have as far as healthcare goes. And we also interview the patients, and this one is data from Uganda. Are you willing to pay to have a nurse use mobile phone and send your information to a remote doctor so you can get better care. So with respect to someone who may be pregnant, if it takes 7 hours plus about $5 to just travel to see a doctor, and if we charge them $2, they will certainly pay that amount. 82% of them said, yes, they would like this because it really helps get them better care, especially for the ones who may be pregnant. It helps save their babies. So we thought there's got to be a paradigm change. Why are patients taking their time and money going to the doctors just to be told they need to be seeing more doctors and more tests? Why can't we bring the doctors to the patients? So we thought if we can empower local clinics, such as the ones run by health workers or nurses, we can actually increase the reach of doctors who can stay exactly where they are to maybe about 10,000 patients versus right now maybe they're seeing just 1,000 patients. And a lot of the skeptics wonder, well, how can you teach a barely literate health worker to use a mobile phone? Well, this is Sabina from our program in India. She said, now we're in a computer world and everywhere computers are being used. In my area, while filling the forms on the mobile, I feel proud. Community people are surprised that we're filling their forms in mobile and not on paper. Wow! Let's not underestimate the power and ability of the health workers who know exactly what the community people need and communicate to them in their own language, in their own culture. These people are powerful agents of change in what we need to do. And with ClickMedix, what we learned is if we can provide the doctors with the data they need through devices such as digital stethoscopes, glucose meter, blood pressure monitor, all of these devices already exist. We package them into the patient record that they're used to seeing along with images and videos. This is really all they need to make a diagnosis. And we present all of them through something so accessible, their phone in their pocket, or web browsers that they can get to. And with that, doctors, when they see this information, literally only takes them 5 minutes to tell someone that they may have cancer or what their treatment needs to be. For nurses, with this information, as well as the doctor's advice, they can actually continue caring for the patient, whether it's medication administration or simple procedures and vaccinations. They'll know what to do. For program administrators, which would be nonprofits, health organizations, who are trying to do a large community-wide intervention, they would have nurses and doctors wherever they are and actually provide very effective care that they can track in real time. How many people are being saved? For patients themselves, patients certainly have mobile phones today. There are more mobile phones than people, 7 billion mobile phones in usage as we speak. The patients themselves can get SMS messages on what they need to do, take their medication, take their baby for vaccination or checkups. Caregivers and family members can also help their sick ones and care for them because they also have a mobile phone. So in order to make this make sense and available as a product for the users, we looked at, well, what does it take to provide good health care? So the process for any healthcare is assess, triage, figuring out what's wrong, getting the diagnosis and treatment, following up and educating the patient themselves as well as family members. If we can make this loop actually continuous, we can provide better healthcare. How do we do that? We created different products so that doctors, such as the specialists, can better, faster diagnose and treat the patients. And we created a training product so that we can train patients, their caregivers, as well as health workers and nurses to care for the patients. And we created a data product that help assess and triage at mass scale. So you need to screen 10,000 people for malaria. We can do that through mobile phones. And all of this contribute to better health care. And for each of the products, we create brochures and marketing materials around the product so that we can very we can target the type of customers we want to use the product so that it builds on this health cycle that contributes to better care. And certainly with any concept pilot, launch, expanding sale, you need to understand your market. And in the healthcare market, if we just look at what the needs are, top 10 causes of death in developed world, Europe, US, elsewhere, about 47% of all deaths are caused by chronic and manageable diseases, diabetes, hypertension, heart diseases, stroke. In developing countries, 23% of all deaths are caused by diseases like malaria, others such as low birth weight, diarrhea, influenza, and pneumonia. And 100% of all of these issues are completely preventable and treatable. We already know how to treat these patients, so why aren't we? Current issues because we're not getting the solutions to the end patients. And if we look at the increasing number of seniors, it will be about 25% of our entire world population at 60 or above in 2030. There's significant need for the solution we're developing, hence opportunity for disrupting the marketplace, because whatever solution we have right now is really not serving the current patients. And there's a significant amount of money, $26 billion from international aid organizations to help developing countries with diseases that we already know how to treat. And data shows that mobile health has increasing access to healthcare, lowering both administration costs as well as savings for seniors, and that there's wide adoption for mobile healthcare and applications. In 2015, prediction is 7.4 billion. And even seniors, 56 to 64-year-olds, 7% of them are downloading mobile apps. And as you know, there are more seniors increasingly purchasing tools such as the iPad, as well as using smartphones. So there's adoption both on the patient end, on the healthcare end, and that there's already proof that this is saving money and creating better access. These are all the bases for creating a disruptive business. But certainly, it's about winning the competitors, because the fixed amount of dollar people have to spend, they will choose the best option they have available. So on a competitive landscape, we position ourselves as the lower cost option that serves all the needs, because it is on a mobile phone. Everyone has access to a mobile device, and it can be value added in terms of costs. And in terms of service, taking that health cycle in the form of how many patients each of these steps could help. Look at assess triage. You can assess triage a lot of patients, diagnose, treat, follow up, but none of these actually connect to one another if you look at existing solutions. A mobile app may do very well with following up with someone's weight, someone's diet habits, but not really tying them into doctors' networks. So with our various products, we drive the adoption and usage of each of these necessary steps for better healthcare, tying them into one another, and then making sure that we are creating a healthcare value chain that's actually useful and helpful to the patients, as well as the providers who want to serve more patients. In terms of marketing and sales, as a small company, we certainly start with creating a reputation, attracting critical customers, and focusing on helping doctors reach more patients, because that's what they're trained to do and that's what they want to do. And there's so much paperwork and other burdens that's tying them down and not enabling them to serve more patients. In one example, in April of this year, I met with Professor Muhammad Yunus. He's the Nobel Peace Prize winner of 2006, inventor of microfinance, and he currently has 8 million people who are in his microfinance program. But a lot of these people, especially the group in New York, there are 10,000 entrepreneurs, women, who are spending a lot of money when someone in their family is sick. This contributes to their lack of ability to pay back loans, and we need to do something about it. So what you're seeing is the women entrepreneur and an example of their shops. This on the right top is their weekly meeting where they talk about their business and talk about how to repay their loans. And with this existing mechanism for community force to help them run their business better, there is a natural platform, a weekly meeting, and loan officers to help even intervene on healthcare. So what we're creating is a healthcare program to help these low-income, most of them Latin American immigrant women, to provide better access to healthcare for them. And what we are devising is an entire healthcare program that starts with lifestyle assessment all the way through diet, fitness, as well as disease monitoring to help decrease the prevalence of diseases in this community, such as diabetes, hypertension. And this also shows snapshots, screenshots of our current application and how we were also designing the product so that it is very easy to use for both doctors, patients, as well as the health workers that are involved. So the health worker would download the application and they would simply enter their login password. They would be instructed on the phone itself. So all they have to do is read the instruction on the phone to use any of the diagnostics tools to capture the necessary information, including videos that they can show to the patient education. And all of these information gets packaged and sent, and any type of accounting tracked to the remote doctor. The remote doctor can do pre-screening, identifying whether this patient may be at risk for diabetes, hypertension, or any other diseases. The doctor can also use his own phone to provide diagnosis, as well as just advice for what to do with the patient. The health worker, again, becomes the empowered change agent to communicate exactly what is going on with their health condition, the health of their family, and what the doctor is instructing. We can also help the patient themselves provide updates to their information, such as glucose, such as any lesions that they're seeing, any symptoms they're seeing, and provide that information to a remote doctor who can provide back really fast response. We can see all the disease morphology over time, and some of the de-identified information can be used for further training and education purposes, and also providing time-based tracking as to how the patient is doing and what's working and what's not. And this ultimately results in potential reversal of pre-diabetic and also weight loss, and simply better, healthier lifestyle that will help them manage diseases. And a short snapshot of potential sales and current sales. Our first sale actually was sold to Harvard Medical. They wanted to do leprosy disease screening in Trinidad and Tobago, and the outcome of that study is showing promise to eradicate the disease and preventing any type of deformation that you're seeing on the screen, potential amputation, through early detection of disease symptoms using mobile phones. And our team is composed of experts in all different areas, including healthcare, technology, business, as well as education. And the impact with what we're doing is estimated to be over 50 million people that we can reach and save. And with the approach of this sort is how we plan on tapping into this $1 trillion market and providing better healthcare for more than billions of people. So happy to answer any question you have, be as specific as you can, and I can also be available on email and later on for any of your questions to help you start business that would be disruptive and valuable to the end users.
Thank you, Ting, for that very interesting. We already have some questions from some of our participants. Ayush, would you like to ask your question?
Yeah, actually I wanted to ask that I know there is a great scope of this, online thing, but if I, think about my daily requirements, like if I have, acne, like I have an acne problem, and if I think I should, just click a photo and send it to that doctor, then I don't think I'll get that satisfaction, because what the patients need is, personal care and attention, which, just, that online system cannot guarantee, or even if you have a, that answer to it, the correct answer even, but I won't get that satisfaction at least. So this is my point.
So in all of our studies, the patients who are asking for help, their alternatives are 6 months wait, or they've already tried different medications, so they are already looking to see a skin doctor for better care. So this is one way for them to see a doctor and get an opinion within just 3 days. So whether the market takes up on this depends on the needs of the patient. So you may not be a patient that would want this service, in which case you would go through the traditional methods. And of course, it's not only for skin diseases. We're seeing a lot of need in the senior population and also in the pregnant and young children population, where a lot of these patients simply can't travel or simply can't use existing methods.
If anyone would like to ask a question, please could you raise your hand. Ting, could you please tell us what were some of the biggest challenges you faced when you were starting up your business?
I would say it wasn't difficult to demonstrate that this really works and getting enough attention around it and for people to try and get customers. One of the most difficult things for me was pricing, because with a global market and the needs we're serving, we have to understand how healthcare is being paid for in each of the markets. So following the money flow has been quite a circuitous trip, because healthcare is paid for by different parties. It's private pay, it's government reimbursed, it's private insurance. So trying to detangle how does one pay for healthcare has been challenging. Pricing has been challenging, and the way we went about it is to understand what's their current cost right now, how can we price it that is either providing more benefit or lower cost, and then packaging that as a service solution. So right now our pricing model is based on subscription fees, so that instead of health organizations or hospitals building an entire mobile health suite that would cost millions or more, they can pay a monthly fee to use our already built and proven service. We also have a customization fee for any one group that wants to have their own workflow or system and their own methods of providing health care. So it's been a long journey in terms of trying to figure out what people are willing to pay for and how much we should price it at. But we're certainly making headways in packaging our services in such a way that is value added. Most of our services sees a return within 1 year of their investment, and then revenue grows quite exponentially from that point on.
Okay, we have a question from Hasni. Hasni, you're unmuted. Would you like to ask your question?
Yes, thank you. Thank you, Ting, for the great presentation. It was just amazing. Wish you luck. My question is of two parts, actually. The first part is about the payment. How do you collect the payment from the patients? And the second question, your relationship with the doctors all over the world, in terms of financially, how you treat with them financially. Do they have percentage or what? And time. How do they save specific time to reply to the patients? Thank you.
Okay. We collect payment in multiple ways. We look at what payment exchange methods there are. So for example, In the U.S., we can take credit card payments through our platform. Elsewhere, the payment may be outside of our system, and we would charge the monthly fee to the healthcare organization, and then they in turn charge the patients. So we design payment into the workflow of the system as well to match exactly what is common in terms of payment in which geography we're serving. If you can remind me of your second part of the question.
My question was collecting the payment and your relationship with the doctors. How much, I mean, the doctors, they take share from the income you get or what?
So our job is essentially to help the doctors do more. So the doctors we work with are those who are maxed out in capacity and really do want to serve more patients, and they're trying to see how they can do that. So our relationship with the customer, with the doctor, is that they're a partner. So we work with them on what their pricing is, and we take a transaction fee for cases that they see. So it's not so much a revenue share, but more of a new service development where we work with them on pricing structure. We work with them on increasing the number of patients that they see. Typically, a face-to-face visit is about 20 minutes. Telemedicine consultation visit is just about 5 minutes. So they're increasing their ability by 4 times.
Okay, thank you.
We also had a question in the chat message. Someone had asked about the accuracy of mobile technology versus face-to-face interactions.
So the mobile technology is, first of all, used as a triage mechanism, because certain diseases, when viewed by a doctor, especially for skin diseases, it's about 65% of those can actually be diagnosed remotely with almost 100% accuracy. The doctors themselves determine whether they are providing an exact diagnosis or whether they need more information. So they've seen literally thousands and thousands and thousands of cases. So they are the best to judge whether they can actually provide diagnosis just based on the information. So it is not a mechanism that always provides back the diagnosis. It's a way to start the process of getting the patient to a medical expert who is experienced in treating specific symptoms.
Okay. We have a question from Walter Lewald. He's in Chile, and he says, thank you for the very good presentation, and he would like to find out if you have any plans for South America.
Certainly. Actually, I met through the Cartier Women's Initiative Business Plan Competition. I did meet a health organization in Chile. I've been to Chile myself as well. Very beautiful country. Certainly have plans in South America, and we actually enter markets quite quickly by establishing contacts that are within the country. So certainly it's on our roadmap to enter South America within the next year or 2.
Great. Could you tell us what was the best advice you received as you're setting up your business in the early stages?
So, as you know, with concept and prototype, there's always a struggle between, do I make the product, sell it, or do I spend my time raising money? And as anyone who's tried this, raising money and selling are quite 2 full-time jobs. Very difficult to do both. The advice I've been told is, you have a product that works, then sell it. So that has been the best advice, because if you can show that you can sell your products, customers are lining up to buy them, there is demand, there is a need, and you are different than any other competitor out there, then actually investment money will come. So if your concept and pilot phase is already mature, you can actually start selling, I would go with sales first before fundraising. At least in my field, fundraising, and at least in my climate, takes about 6 months to 6 months or so and it's full-time dedicated effort. So by going down developing mature product that's commercially viable and pricing and selling and working with the customers, I've actually been able to increase the worth and valuation of the company, which actually makes investment round much easier.
Okay. We have Ayush has raised his hand. Ayush, would you like to ask a follow-up question?
Yeah, like I saw you on net. Actually, I was thinking like I could be also on that place because I really admired you. I'm also a new entrepreneur. I have a concept on something else, and I'm afraid actually to go into the market and ask for funds. Like you had a different concept. Weren't you afraid that like if you go in the market, people will steal your concept or something, or maybe that that you'll get difficulties too? That's it.
So you're absolutely right there. Once you let your idea out, if it sounds good, you will have a lot of what I call vaporware. So you may see a website that's talking about exactly what you're pitching, and all of that do cause risk to you developing your business. What we've done is we always start with a small trusted network of user base. So since we target patients, doctors, health organizations, we start working with them to develop something that they want, and then start testing the market in a very controlled environment, going through people we know we trust, but who will give us real honest feedback on, as small as this button should just not be there, or I'm confused, I need more instructions, I don't get it. So testing out with primary interviews, working with people seeing whether this idea sticks, and also starting to build your marketing and sales before you talk about it more in a public base, because you do have to be prepared for copycats and vaporware that looks just like you. You have to be able to actually capture the user base before they do. So I would advise towards making sure you have a concept and a product to back that up. So when you do publicize what you have, you can actually begin the sales quite readily. So that gives less time for a competing product to use your idea and take over what you've developed. Another advice is there are also others who are interested in your product, and they may look like a competitor, but sometimes they could be a collaborator. So depending on the concept and the industry you're in, for example, in healthcare, it would require a lot of collaboration. So actually look at some competitors as potential collaborators as well.
Okay, we'll take the next question from Kofi, and then we have a follow-up question from Walter.
Great.
Yeah, hello.
Hi.
Hello.
Hi, we can hear you.
Yeah, I'm from Ghana, West Africa, and do you have any plans for us here in Africa, because we have problems with medical centers and a few doctors here and there. So telemedicine is something that is going to be of real help to us, and looking at how internet is improving here, information technology is now being available to the people, so telemedicine will be something great. And then more importantly, how do you pay the money, because Africa has got problem with payment systems. It's inadequate. Thank you.
Right. So so I actually did a pilot program in Ghana, and Ghana certainly has a lot of needs, and we've done a dermatology pilot there, both in the capital area as well as rural areas, and of course the same mechanism can be used for various diseases. So for us to enter a country, all we need literally is willing health organizations that want to partner and really want to scale up from that point up. And we work with health organizations that care about sustainable model, not so much donor and aid based, because we see this as a way, a new service delivery that's already proven and it works. And in terms of payment, typically we will go with whatever payment that works right now. So maybe cash exchanges, and then we would charge the health organization, whether through wire transfers or some other mechanism or through an intermediary party. We also work with mobile companies in different countries because they're a ready payment mechanism already. people already transact and pay through mobile phones, and that's one mechanism we're actually looking to further develop, working with the mobile companies.
So is it possible to have partnership with you to kind of get patients to get diagnosed and stuff?
Can you repeat the question, especially the first part?
Oh, okay, thank you.
Kofi was asking if it's possible for him to get a partnership with you to offer the service.
Yes, certainly. You can tell everyone my email address is ting@clickmedix.com.
Oh, okay, thank you.
Walter, would you like to ask your question?
Hello. Hello, Ting. Can you hear me?
Yes.
Okay. I'm a volunteer also at the Gen Marketplace. So first, thank you for your time and effort. Second, I've been using that same technology. I'm currently in Chile and my mother lives in Mexico. So normally I take pictures of my 2 years old when he has a rash or something like that. And my mother is a nurse. So we have been using your, without a license, your technology. And precisely yesterday, I did the same with my dog, who is a 65-kilogram Neapolitan Mastiff. And he's sick, and I took a picture of him, and I sent that to his former veterinarian who is also in Mexico yet. So because it's when you move, it's different. So
yeah.
Basically, my idea is suggesting you other areas. So one is going from human healthcare to pet healthcare, which is also a huge industry. And the other is crossing borders with countries in Latin America. And I will also say you can count on us with any help you can need here in Latin America.
Oh, great. Please do contact me through email, and maybe we can begin some conversations. So we've actually looked into beyond human care, pet care, as well as agriculture care. If you think about the mechanism, simply pictures, information, text that's needed for someone else who's very experienced to provide help on what to do, whether it's pet, plant, people. The mechanism for information exchange is quite the same. What we've added onto the platform to make this legitimate, legal, and into a business model is that we can mimic a workflow of what's currently being done. So for example, you're sending pictures to, I believe, your mother who's a nurse who can provide back some advice. You can also send it to a doctor, and they would take the case if there is a way for them to get compensated, whether through time or some other benefit or payment. So that's what the platform does, is to figure out what is the workflow, how do we build a payment model on top of that, and how do we launch it as a business so that you, as a person who needs help, can get someone who's willing to help because they know that this is a proven mechanism, they know they will get paid in or compensated in some way, and that this is legitimate and that your information is genuine and everything is protected. So be happy to work with anyone on the call to further explore service models we think would be viable.
Thank you very much, Ting. We're arriving at the end of our sessions. Just take the last two questions. This one is from Apio Christine, and she asks, how did you handle negative responses during your testing of concept?
So some of the negative responses were a lot of it about payment. A lot of times people are saying, well, how much does it cost? And they may not be able to afford it. Second response is sometimes a trust issue. So for the payment issue, we price it according to whatever they're paying now. And it's actually very easy to show that there is cost saving when you think about your wait time, opportunity cost, transportation cost. So that wasn't too difficult. second part on whether this actually works. So patients innately trust the doctors. In a lot of countries, the doctors are somewhat viewed as demigods. So we incentivize the doctor to use this because it helps them better care for their patients, which is, for most of them, it's why they became a doctor in the first place. And with the various pilots, which is why we actually needed to do all of this research, we proved to the doctor that they can trust in this model, this service, is proven it really works. And for them to suggest it to their patients, because ultimately it enhances the patient-doctor relationship by helping the patient get better sooner. So that's what we've done in terms of resolving all the negative comments, and it's certainly something that all of your businesses should take very seriously, especially in the initial stage. The initial feedback, reaction from customers or users is key to how you develop and how you prioritize what you want to address first.
Great. The last question we'll take is from Ibrahim Al-Jubari, and he asks, did your education influence your business idea, and how? And also, what support have you received from your surrounding environment, family, friends, peers, etc.?
So education certainly shaped the way the solution is developed. So I was trained as a computer scientist and then went on to software engineering and then systems engineering and then business school. So I've also worked for more than 10 years, all of the ways in which solutions have developed are technology oriented. So not a surprise that the way I see healthcare can be improved is through technology, because we are in the digital age, but our healthcare is still delivered by people walking from home to the doctor, and so is the information. It's delivered through paper and mailing as well as fax. So the solution obviously tied very closely with my education, and in terms of support, and as any of you who have started your entrepreneurship journey, it's a roller coaster ride. I mean, there are high points and there are low points like you would not believe. Support network is definitely important. Family, friends, yes, I have some that I can count on. What I found quite useful are other entrepreneurs, whether they're in the same business or not, they're going through the same journey as you are. The highs and the lows, and also some tips on how do you bootstrap, how do you do marketing so effectively. Oh, you have 1,000 Twitter followers, well, can you help me promote this and that? So I'm really finding that, just as why I'm involved in the Yang marketplace is that other entrepreneurs are there and willing, especially the ones in different businesses, to really help you, because we're all really going through the same thing, the same struggles, and we're going through the same solutions too. So why not really share ideas and work together and really help each other, because it's a hard journey, it's long, and there are great happy times and there are also very depressing times. And I really think you need to build a support network from around you and also abroad through online networks like this one.
Great. Thank you so much, Ting, for this fascinating presentation and talk. I'm sorry we couldn't get to everybody's question during our session, but you can reach Ting at her email address, ting@clickmedix.com. It's in the chat. And just before we go, I just wanted to do a bit of follow-up. And so just really quickly, a bit of follow-up. You can see Ting's presentation, or if you have anyone you think would be interested to see it again, they can see it on our website. The address is in the chat. Sharon will put it there. And they can also go to our Facebook page. It's called the Youth Employment Network. And there you'll also see the video recording of the presentation. I just want to announce that we'll have our next entrepreneur. Next week is Emily Duboulet, and she's the founder of Sasti Party. That's a green business, and she owns a B Corp company and considers herself to be a conscious capitalist. So please join us next week to find out how she is a business which has a triple bottom line. Lastly, one last poll. Could you please rate our event? A poll should come up right about now for you to rate whether you thought, how you found the presentation. Everyone seems to have voted. Okay, so 45% found it awesome and 55% found it good. That's really encouraging. Please feel free to leave us a message in the chat if you have any ideas on how we can further improve. And otherwise, I hope to see many of you back next week. If you would like to register for the event next week, you can please raise your hand at this time and we'll take down your name. And Sharon will also put a message in the chat in case you want to register at a later time on your own, or if you would like to share it with other young entrepreneurs or people who might be interested. So kindly raise your hand if you want to participate for the next session. Okay, wonderful. Thank you very much, everyone, for your participation. Thank you, Ting, once again. And we hope to see you next week.